Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for a patient with newly diagnosed Type 2 diabetes. In this module, you'll learn what's involved in caring for a patient who's been newly diagnosed with diabetes and how to deal with common patient questions and concerns. We'll begin with the report you received from the nurse who was last on duty. The summary report you'll hear today is in the SBAR method: situation, background, assessment, and recommendations.
All right, thanks. Bye. Hi, Kent.
Hey, how are you, Barbara?
I'm doing well.
Good.
So you'll be the next nurse for Mrs. Rodriguez?
Yeah, what do you have for me?
Well, Maria Rodriguez is 60 years old. She's allergic to penicillin and a patient of Dr. Lindman's. She was admitted with a left foot injury and newly diagnosed type 2 diabetes. Mrs. Rodriguez came into the emergency room because of a wound on the ball of her left foot. She doesn't know exactly when the injury occurred, but she first noticed that the area was red and swollen last week. Mrs. Rodriguez does report walking barefoot frequently in the house and yard.
Okay, what did they find out in the ER?
Her temperature was elevated at 99.9, and her blood pressure reading was 150/88. Her heart rate was 85, her respiratory rate was 14, and her oxygen saturation was 98% on room air. Other assessments included a CBC, Chem7, blood cultures, and a culture sensitivity on the wound drainage. The lab results came back with abnormal values for the white blood cell count, 17.5.
That's a little high.
Yeah, and glucose of 356. The glucose level was treated with 10 units of insulin sub-Q in the ER, and she was also given 1 gram of vancomycin IV in the ER. She'll be on the vancomycin until the culture and sensitivity studies come back. The ER also consulted podiatry, so there'll be a podiatrist coming in around 9 a.m. to assess the foot wound and change the dressing. Mrs. Rodriguez has a history of obesity, frequent urinary tract infections, and hypertension. The only medication she was taking at home was hydrochlorothiazide, 25 milligrams daily. Now for her systems assessment. Neurologic, she is awake, alert, and oriented ×3. Cardiovascular, her heart is regular, and there is an IV site in her right forearm. Respiratory, her lungs are clear to auscultation. Gastrointestinal, her abdomen is soft and non-tender to touch. She's also on an 1,800 calorie, no concentrated sweets diet. We're doing blood sugars AC and HS. Her finger stick this morning was 405, so you'll need to give her insulin prior to breakfast. Genitourinary, she's voiding clear yellow urine without difficulty. Integument, the left foot dressing is clean, dry, and intact. She has positive PT and DP pulses, and capillary refill is normal, although she does have decreased sensation bilaterally around the ball and big toe of each foot. She'll be on the following medications: vancomycin 1 gram IV, metformin PO BID, an insulin sliding scale AC and HS, and acetaminophen for fever or pain.
Okay, so what would your recommendations be?
I'd make sure she gets morning insulin for her blood sugar of 405, and she needs to be educated about the different signs of hypo and hyperglycemia, and definitely diabetic foot care.
Okay, I can handle that. Thanks.
You're welcome.
Have a good day.
You too. Oh, I forgot to tell you that her eldest daughter is also staying in the room with her.
Okay, thanks for the heads up.
No problem. Bye.
You're about to watch a registered nurse conduct a focused assessment of a patient with newly diagnosed Type 2 diabetes. Note how he performs each step and, just as important, how he explains what he's doing to help the patient understand what's being done and why.
Plan on going. We'll see.
Good morning, Mrs. Rodriguez. I'm Kent Bachman. I'll be your nurse today.
This is Julie, my daughter.
It's nice to meet you, Julie.
Hi.
Give me just a moment. Let me set some things up, all right? Okay. All right. Give me just a moment to wash my hands. I'll be right with you. Okay. Let's begin by checking your identification, please. Could you tell me your name and your date of birth, please?
Maria Rodriguez, March 11, 1949.
Thank you, Mrs. Rodriguez. Are you allergic to anything?
Penicillin.
Good. That's great. Everything matches. Thank you. So, I hear a foot injury brought you to the ER last night.
Yes, it was strange. My foot never hurt. But last night it just had all this liquid draining out, and it smelled really bad. But what worries me the most is that last night in the ER, they said that I was a diabetic. I've never been a diabetic.
So you're saying that diabetes is a new diagnosis for you?
Yes.
No one's ever mentioned it as a possibility before. We're very worried.
Well, it will mean some changes, but many people adapt well after learning how to take care of themselves.
Why do the doctors think it's diabetes?
That's a good question. Mrs. Rodriguez, would you like to know?
Very much.
Well, last night when you came to the hospital, your blood sugar or blood glucose level was very high. Normally, the blood sugar level should be no higher than 110, but last night yours was 356. And an elevated blood sugar is one of the hallmarks of diabetes.
So when they say blood glucose, is that blood sugar?
Yes, it is.
Oh, I didn't understand that either.
Well, you see, the body produces a substance called insulin, which allows glucose to be transported from the bloodstream into the body's cells where it's used for energy. And this lowers the blood glucose level. But in people with diabetes, either the body doesn't produce enough insulin or the body's cells don't respond to the insulin that's produced, and as a result, the level of glucose in the blood increases. So right now, you're on both a pill and insulin to lower your glucose level.
Really?
Yeah, with type 2 diabetes, the blood sugar level is usually managed with what we call an oral hypoglycemic agent. In your case, that's the metformin, which you will take before breakfast and dinner.
So, when we go home, Mom will be only taking the pills.
Yes, but while she's in the hospital with us, we will give her both the pill and insulin. The reason is insulin works quicker to lower blood sugar, and this allows greater control over the blood sugar, which is important because lowering the blood sugar makes it easier for your foot to heal.
That makes sense.
So now, what we're gonna do, I'm gonna take your vital signs, I'm gonna complete some other assessments, and then I'm gonna give you your morning insulin dose, which is 12 units of regular insulin. Okay? Okay, so let's get started with the vital signs. Let me just raise your bed up here. Okay. First thing we're gonna do is take your temperature. Okay, under your tongue, please. Okay, 99.0. You're still running a little bit of a fever. Okay, Mrs. Rodriguez, next we're gonna check your blood pressure. You know how this works. It's real simple. I'm just gonna put the cuff on your arm, and then we're gonna squeeze it up a bit. Okay, just relax for me. Thanks. Okay, here we go. Okay. 130/84. Good, that's down a little bit from last night. All right, next, I want to check your heart rate, okay? Just relax your arm for me. Thank you. Okay, your heart rate is 76, and your respirations are 14. All right, and last right now, let's check your oxygen saturation. Now, this is real easy. Just pick a finger for me. That's good. Okay, thank you. 98%. Terrific. And now, I'd like to listen to your heart sounds. To do that, I'm going to need to listen under your gown, though. Is that okay?
Okay.
Okay, I'm going to close the door for some privacy, all right?
When performing a cardiac assessment, listen to the 5 areas of the heart, checking for any abnormal heart sounds. Document the heart rate and rhythm after your assessment and notify the doctor about any abnormal sounds.
Here we go. Okay, I'm going to come up from under the side here. That's fine, thanks. Okay, and for this last one, if I could ask you just to roll a little bit onto your left side, that'll let me listen from a different angle. That'll be very helpful. Take your time. Careful your foot, nice and easy. Okay, right, that's terrific, right like that. Okay, thank you. Go ahead and lay back the way you were, all right? Take your time, all right? Okay, your heart sounds are regular, and there are no unusual sounds.
So her heart sounds good.
Yes, it does. Okay, Mrs. Rodriguez, now I'm gonna listen to your lungs. I just wanna make sure they're clear. Now, to do this again, I need to listen under your gown, okay?
All right.
Okay, here's what I need from you. I want you to just take regular breaths. I'm gonna listen in front, then in back. Just take regular breaths, nice and easy, and breathe through your mouth for me. That'll help me, okay? All right, thank you. Good. Great. I'm gonna reach way around here, okay? Stay where you are, you're fine. You're fine. Okay. One more over here. Okay. Now, if I could, I just need you to lean forward for me. You need a hand here? Nice and easy. Good, that's perfect. Keep breathing. Don't hyperventilate. Nice. And almost done. Great. Thank you. Your lungs sound fine. Go ahead and lean back for me. Good job. Okay. Now, gonna listen to your stomach this time. And I do need to listen under your gown a little bit. Is that all right?
Yes.
Okay. All right.
Okay.
Okay. I've got you. Thank you. Good, I'm hearing lots of gurgling sounds. That means everything's working. Actually, last thing, I just need to feel down there. Okay. You feeling any pain or discomfort when I do this?
No.
Okay, good. Okay. Good. Thank you.
Thanks.
Okay, next we're gonna move on to your IV site. Just wanna take a look.
Okay.
When assessing the IV site, check for redness, edema, or drainage.
Do you feel any pain or discomfort here?
No, it feels good.
Good.
Any of these findings is an indication that the IV site should be changed.
Okay, looks all right. Thank you. All right, what I want to do next is look at the wound on that foot. All right, but first I just need to wash my hands. I'm gonna put some gloves on.
All right.
Okay, and actually, we're gonna take a look at both of your feet at the same time, okay? I'm just gonna pull the sheets up a little bit.
All right.
Gently. Okay. Now. Okay. Looks like your dressing is clean, dry, and intact. Oh, by the way, your podiatrist is going to be here this morning. They told me he'd be around 9 o'clock and that he'd prefer to do the dressing change together.
Okay.
High blood glucose levels over time can lead to nerve damage and poor circulation, especially in the legs and feet. And because of the impaired sensation, some patients may not even be aware that an injury has occurred. In addition, due to the impaired blood flow, the area receives less oxygen, nutrients, and infection-fighting white blood cells. This can delay healing and cause serious complications.
Okay, next what I'm going to do is check the sensation and the circulation in your feet. And what I'm going to ask you to do is close your eyes. I'm going to touch your feet in various places, and I'd like you to tell me where you feel it, okay?
All right.
So go ahead and close your eyes.
Little toe. Heel. Little toe. Heel.
Mom, you didn't feel him touching your big toes?
I didn't know he was touching my big toe.
Not being able to feel your big toe, that can be a side effect of the diabetes, okay? Next, I'm going to squeeze your toes just a little bit. By squeezing your nail beds, it's going to help me assess the circulation in your feet.
To test capillary refill, briefly compress the nail bed so it blanches, and then release the pressure. Normally, reperfusion occurs within 3 seconds, as evidenced by the return of color.
Okay, now we'll check your pulses.
When assessing pulses in the lower extremities, check both the dorsalis pedis and the posterior tibial arteries on each leg, noting the presence or absence of the pulse and its quality. If you're unable to palpate the pulses with your fingers or are unsure about your findings, use a Doppler for confirmation.
Okay, and last, I just want to check for swelling or edema in your feet. Okay.
While assessing for edema, also compare the temperature of the lower extremities to the rest of the body.
Is it swollen?
Well, this one a little bit. It's what we call +2 edema. How about we try to relieve some of that swelling by elevating your foot a little bit?
That would be good.
What's this? Let me help you. Okay. All right. Right there. Let's put this back. Nice and gentle. All right. Okay. All right. Left foot, slightly warm compared to rest of body with +2 edema. Right foot, slightly cooler than rest of body. All pedal pulses palpable at this time. Capillary refill, less than 3 seconds bilaterally. Decreased sensation on bilateral feet. Okay, Mrs. Rodriguez, Because the diabetes can affect your ability to detect injuries to your feet and can also delay healing if you do get injured, it's very important from now on that you wear shoes that fit properly, and also that you try to avoid walking barefoot. A cut or blister on your foot could turn into a big problem.
Yes, I guess I learned that the hard way this time. I'm gonna miss going barefoot, though.
You'll need to change that, Mom.
I know.
It's also very important that every day you check your feet for blisters, cuts, red spots, or swelling. That way you can catch a big problem before it gets even bigger, okay?
You'll remember that, Julie?
Yes, Mom.
Okay.
Okay, now it's time to administer your insulin. As I mentioned before, the insulin will help lower your blood sugar, and it's also going to help your foot to heal faster, okay?
Will it hurt?
Well, there is a needle involved, but we'll try to make it as comfortable as possible.
Okay, I guess.
It's gonna be all right, Mom.
Now, we always want to make sure the right patient's getting the right medication, so while I'm checking your record here, could you please repeat for me again your name and your date of birth?
Maria Rodriguez, March 11, 1949.
Thanks. And yes, I did ask you this before, but I just need to check your allergy bracelet. Okay, it says you're allergic to penicillin.
Yes.
Okay.
In the scenario you're watching, the nurse has already drawn up the insulin in the medication room prior to entering the patient's room. And in the medication room, a second RN has double-checked the medication and the dosage.
Let me just wash up here 1 second.
The procedure for administering insulin is as follows. Wash your hands and put on clean gloves. Select an administration site on the back of the arm. Clean the area around the administration site with an antimicrobial swab. Use a firm circular motion while moving outward from the injection site. Allow the area to air dry. Remove the needle cap with your non-dominant hand, pulling it straight off. Grasp and bunch the area surrounding the injection site. Hold the syringe in your dominant hand between the thumb and forefinger.
Now you're just going to feel a little stick.
Inject the needle quickly at a 90-degree angle. After the needle is in place, release your grip on the tissue and inject the medication slowly with the needle at the same 90-degree angle.
That's it.
Oh, I didn't feel anything.
You see, not so bad, huh?
Engage the safety shield or needle guard. Then, using a gauze square, apply gentle pressure to the site after the needle is withdrawn. Dispose of the needle in a sharps container. Remove your gloves and wash your hands.
Okay, that's it. Now, as I said, the effects of the insulin and the metformin will be to lower your blood glucose level to a normal range. But we don't want to go too low. A blood glucose level that goes too low is called hypoglycemia, and that we want to try and avoid.
What happens with hypoglycemia?
Well, some of the symptoms of hypoglycemia include shaking, sweatiness, nausea, weakness, mood swings, nervousness, and blurry vision. So if you notice any of these symptoms, please tell me right away, okay?
You'll remember that, right, Julie?
I will, Mom. I think a little later on, Mr. Buckman and I will talk about the symptoms, if that's all right with you.
Yeah, that would be great. I was hoping we could all find time to get together to talk about diabetes, what it means, signs and symptoms, and come up with a plan for you when you go home.
Oh, that sounds good. I really would appreciate it.
Okay. Anything else I can do for you right now?
No, thanks.
Okay. You have your call bell?
Oh, yeah, it's right here.
All right. You make sure you hit it if you need any help, all right?
Okay, thank you.
Okay. I'm just going to lower you for safety here, all right? All right. I'm going to tidy up, and then I will be back.
Thank you.
Sure.
Yeah.
You will return all of the equipment and promote good infection control practice by washing your hands. When compiling your report, keep in mind that by noting trends from one assessment to the next, you can provide helpful insights for the patient's care. Based on your assessment, nursing diagnoses for Mrs. Rodriguez may include knowledge deficit related to diabetes self-care skills and information, alteration in skin integrity related to foot wound, and potential for injury related to decreased sensation. Thank you for watching this video on caring for a patient with newly diagnosed type 2 diabetes. Be sure to also study the instructions in your textbook, and please review this presentation at any time to support your learning and patient care.